So Cygnet Hospital Harrow has 4 wards. It has an acute service for both male and female, so it's 20 beds. We also have 3 spring services, which are to cater and support those with ASD. And generally there'll be mild LD, but quite high functioning. We have a low secure service, which is 16 beds, a Springs Centre service, which sits in between the unit and the wing, and that is for 14 beds, and it's a high dependency unit. A step down from there is the Springs Wing, and that is 10 beds, and it is for those, again, with ASD, very similar to the Springs unit and centre, but from there, the plan is to move them out into the community, so it's their last step, really. Cygnet Hospital Harrow is located on Harrow on the Hill, which is a great location. One, because we have 6 acres of land private to this area, but also great facilities like parks, a lot of the sports grounds, Harrow School's very nearby as well. The amenities include shops in the Harrow Town Centre and the leisure centre that's out there, which enables us to have some very good links. On top of that, we've also got very good networks with the train station, bus service, and good parking space where we are as well, which is great when we want family and friends to come visit.
The local environment at Cygnet Hospital Harrow is a very friendly environment. We work with highly qualified individuals who are very experienced in working with autism and mental health. The spring services have recently been refurbished. We now have large communal areas. We have a large kitchenette for service users to cook independently, all supported with the occupational therapists.
The diagnosis that patients on Spring Centre and Spring Wing presents with are specifically Autism Spectrum Disorder, associated with mild learning disabilities and comorbidities like psychosis, depression, anxiety, personality disorders.
The MDT consists of a consultant, a ward speciality doctor, learning disability nurses and mental health registered nurses. We have our healthcare support workers, occupational therapy, psychology and a personal trainer.
The interventions and therapies provided on the Spring Wing and Spring Centre are assessments like ADOS-2, which is a specialist assessment for autism, assessments like MCMI, which is a specialist assessment for personality disorder unit, also assessments like WACE, which is an assessment for learning disability. Along with these, we also provide assessments for general psychiatric conditions like depression, PTSD, anxiety, and psychosis.
First of all, we carry out specialist assessments. So we're looking at personality, we're looking at cognitive functioning, we look at their general psychological functioning, and based on that, we provide a formulation which will then inform our psychological interventions. Some of the interventions we carry out include adapted CBT that is tailored to the individual's needs. We might also conduct functional analysis if an individual is displaying challenging behaviours for the reason that they may not be able to articulate their thoughts and feelings. And then we develop specialised behavioural management plans in order to support the individual and understand what the communication needs might be.
We're trying to give the service users the power, and the onus is on them to be part of their recovery. So the activities are very self-directed, where we guide them and find out what they like and then incorporate that into their timetable. But we also have community links where there's day centres and there's MVQ courses that they can tap into, and those are woodworking, photography, computing. The groups we're running are pampering groups like self-care groups, and we also have a discharge and recovery group to support them and to educate them for, taking ownership of their recovery and independence.
The aim of the Spring Centre and the Springs Wing is to support service users and give them the tools to be discharged into the community. This is with the support of not just only the MDT, but also the carers and the family. Some of them live quite far away, and it's important that we help and enable them to be safely discharged and obviously into their next final placement on their recovery journey.
We have a very good success rate of individuals returning back out into the community. We have had service users that have gone from throughout the entire pathway, which have actually gone from the low secure service down into the rehab and then eventually onto the open unit.
So one positive story that we had that I was heavily involved in when we had the recovery college, we had a Springs unit patient who was with us for a long length of time, moved down that pathway and was safely discharged. They're now heavily involved in the recovery college and they work as an expert by experience with those that have ASD.